Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss few practice questions from the pathology and medicine section. We'll discuss 80,000 and 90,000 series together. Okay, so let's have a look into it one by one. So let's move on to the first question. Patient is coming in for a pathological examination for ischemia in the left leg. The first specimen is 1.5 centimeter of a single portion of arterial plaque taken from the left common femoral artery. The second specimen is 8.5 into 2.7 centimeter across 1.5 centimeter in thickness of a cutaneous ulceration with fibropurulent material on the left leg. What surgical pathology codes should be reported for the pathologist? Okay, so this is something which is related to surgical pathology. So in the CPT code book, you can just go to the just open CPT code book and take surgical pathology. In that you will get few codes starting with 88. Okay, 88300, 88302, like that it goes on. And how to code surgical pathology, that is clearly mentioned in the initial section. I think I had taken few guidelines during the pathology consultation, surgical pathology consultation. Still, we will look into it once again. Okay, so just open surgical pathology. In that, it's clearly mentioned in the after one or two paragraph, it's mentioned service code 88300, the first code. Service code 88300 is used for any specimen that, in the opinion of the examining pathologist, can be accurately diagnosed without microscopic examination. There is no microscopic examination for the code 88300. If you check the code also, it's written there, level 1. Surgical pathology, gross examination only. Okay, so it means only gross examination. There is no microscopic examination. So that's why that is level 1. The first stage of pathology consultation is level 1. That is 88300. When it goes to the next level, level 2, you will be using the next code. Like that it goes on. Level 3, level 4, level 5, like that it goes on. Okay. So which level we have to select, that we need to check it from the question. So anyway, this is not level 5, sorry, level 1, because this is level 1 is only gross examination. We have microscopic examination. So that will not be the answer. Okay. Now, our first option is 88302. So let's look into 88302. Before that, in that same guideline paragraph, it's mentioned there about the next code. Service code 88302 is used when gross and microscopic examination is performed on a specimen to confirm identification and the absence of the disease. Here, microscopic examination is also there. But still, what does it represent? When gross and microscopic examination is performed on a specimen to confirm identification and the absence of the disease. This is only a limited access, it represents only a limited to the confirmation of the identification or the confirmation of the the disease, if it is present or not. It represents, this code 88302 code represents only the presence or absence of the disease and the confirmation. Okay, but here in our question, it's clearly mentioned the patient is coming in for pathological examination for ischemia. The disease, the main diagnosis is already present there. For the ischemia, the patient has come in the left leg. Okay, so this will not be the code, because this is used to represent the absence of, if the disease, the particular disease is not mentioned, then we will go for the level 2 procedure. Okay, so 88302 will not be the answer. So we will skip the first option. Now take the second option, 88304, 305. So 88304 is the Level 3, the next level. Next level surgical pathology consultation is 88304. In our question, it's mentioned about the first specimen. So here there are two specimens, right? So we need to code it separately. So for the first specimen, it is 1.5 centimeter of a single portion of arterial plaque taken from the left common femoral artery. So this means arterial plaque we need to check if it is present in the level 3 procedure. So if you go to the code 88304 level 3, see there are so many procedures mentioned in level 3 surgical procedure. In that we need to check whether our procedure which is done it's present or not. That is the main thing. Okay, arterial plaque. Just check if arterial plaque is mentioned there. Yes, it's mentioned there, right? Artery, atheromatous plaque. It means arterial plaque. So arterial plaque is mentioned there. So we will code 88304 as the initial code. Okay. And what about modifier 26? It's mentioned there 88304 with modifier 26. Modifier 26 is the professional component and TC is the technical component, because this is built by a physician, the surgeon itself. So we will use the modifier 26. Now, so we had mentioned 88304, or we got the first procedure code as 88304. Then for the next specimen, it will be the adjacent code itself, because that is the additional codes. If we are coding 88302 as the initial code, we will use the second specimen code as the next level 3 code. We will not go directly from level 2 to level 5, no, or level 2 to level 4, no. If level 2 is the first code, then we will be using level 3 as the next code. If there is 3 specimen, again level 4 as the third code. Like that it will goes on. So here our procedure is level 3 is the first 88304, which is level 3 is the first code. So for the second specimen, we will use the code 88305, level 4 procedure. Okay, 88305 with again with modifier 26, because direct pathologist itself is doing the procedure. We will append modifier 26. So the answer will be option B, 88304 with modifier 26 and 88305 with modifier 26. Okay, that's how we need to code. Now, let's move on to the second question. During a craniectomy, the surgeon performed a frozen section of a large piece of tumor and sent it to pathology. The pathologist received a rubbery pinkish tan tissue measuring in aggregate 3 into 0.8 into 0.8 centimeter. The entire specimen is submitted in one block and a microscope was used to examine the tissue. The frozen section and the pathology report are sent back to the surgeon indicating that the tumor was a medulloblastoma. What CPT codes will the pathologist report? So during a craniectomy procedure, the surgeon is performing in the frozen section of, like has taken the piece of frozen section of tumor and then send it to the pathology. Okay, so here the presence of surgeon is there. Surgeon is present. Anyway, let's look into the options one by one. First option 80500. Just open 80500. What is 80500 in the CPT code book? Clinical Pathology Consultation Limited without review of patient's history and medical records. This is limited, it's mentioned there. But since this is surgical procedure, it will not be limited, right? And what is 80502 option C? Comprehensive. For a complex diagnostic problem with review of patient's history and medical records. Okay, anyway, let's move on to the other two options also. Option B, 88331. What is 88331? Pathology consultation during surgery. Yes, this is pathology consultation, right? Because the surgeon has taken the sample and send it to the pathologist. So this is pathology consultation. The consultation will be from the pathologist. So pathology consultation during surgery, 88331 is first tissue block with frozen section, single specimen. Yes, the first, we have only one specimen. We don't have any first section or second section. We have only one section, frozen section. Measurement is mentioned there. And then that entire specimen is submitted in one block. Okay. So this is first tissue block. 88331 is first tissue block because we have only one sample. And then it is sent to the pathology for the reporting. Surgeon. So surgeon itself is doing the sample taken, and then it's sent to the pathologist. And who is doing the procedure? Pathologist itself is doing the procedure. So we will append the modifier 26. So this will be the answer. But what about option D? It's mentioned another additional code 88304. What is 88304 with modifier 26? That is just consultation, surgical pathology consultation. Surgical pathology, gross and microscopic examination level 3. No, we don't require that because we are, this is not a consultation. This is not a direct consultation from the pathologist. The surgeon has performed taken the sample and send it to the pathologist. So only one option, only the procedure we will be coding. So the answer will be option B, 88331 with modifier 26. Okay, pathology consultation during surgery, first tissue block with frozen section, single specimen, because this is single specimen. So the answer is option B. Moving on to third question. A patient uses topiramate to control his seizures. He comes in every 2 months to have a therapeutic drug testing performed to assess serum plasma levels of this medication. What lab code is reported for this testing? So this is therapeutic drug testing, right? It's clearly mentioned there. In every 2 months, the patient is coming for a therapeutic drug testing. So let's look into the options one by one. Option A, 80305. What is 80305? If you can see, if you open the CPT code book, you will see options 80305 and the second one 80306. It comes under presumptive drug class screening. This is not therapeutic, this is presumptive drug class screening. So that will not be the answer. Our question is therapeutic drug testing. So move to option C, 80201. What is 80201? 80201 is, it comes under therapeutic drug assay. And which medicine here the patient is using? Topiramate. So what is 80201 procedure, the CPT code? 80201 is topiramate. Okay. So our answer will be option C. Topiramate, therapeutic drug assay. Option D, 80339 also comes under presumptive drug class screening. 803 starting comes under presumptive drug class, and 802 starting 802 will be from therapeutic. So our answer will be option C, 80201. Fourth question. Cells were taken from amniotic fluid for analyzation of the chromosomes for possible Down syndrome. The geneticist performs the analysis with 2 G-banded karyotypes analyzing 30 cells. Select the lab codes for reporting this service. So this is for what procedure? Analyzation of chromosomes for Down syndrome. And what sample has been taken? Cells from amniotic fluid. Okay, let's go to the options one by one. First option, 88248. What is 88248? Just open 88248. You will get chromosome analysis for breakage syndrome. This is not breakage syndrome, this is Down syndrome. So leave that option. Now moving on to option B, 88267. What is 88267? Chromosome analysis, amniotic fluid or chorionic villus. Count 15 cells, 1 karyotype with banding. Yes, this is Down syndrome. Down syndrome is not mentioned here, but this is chromosome analysis, right? Chromosome analysis, amniotic fluid. We have taken the sample from the amniotic fluid. So this will be there. Now what is the next code? Same option B, next code 88280 and 285. 88280 represents chromosome analysis, additional karyotypes, each study. Because in our question it's mentioned there, the geneticist performs the analysis with two G-banded karyotypes analyzing 30 cells. 30 cells they have analyzed. So in the first option 88267, it's only 15 cells and one karyotype. So we will go to the another like 30 cells option 280 additional karyotypes each study, means each additional karyotypes, each study. Now what is 88285? Additional cells counted each study. So we had taken initially 15 cells, code for 15 cells is 88267. Additional cells, code for additional cells is 88285. And for two karyotype, the first code 88267 is only one karyotype. So two karyotype, each additional karyotype it's mentioned there. The second code 280. So these all three should be coded together. Okay, because that's why they have clearly mentioned in the question two G-banded karyotypes and analyzing 30 cells. And the sample is taken from amniotic fluid for the Down syndrome. So our answer will be option B. If you want, you can check the other option also. Option C, 88273. What is 273? Chromosomal in situ hybridization. This is not in situ hybridization. So leave that. If you check option D, 88262, it's mentioned just chromosome analysis. It doesn't mention about any amniotic fluid or from where the sample is taken. It's not mentioned there. That is mentioned clearly in the option B, 88267, amniotic fluid. Okay. So our answer will be option B. Now moving on to the fifth question. A 4-year-old is getting over his cold and will be getting 3 immunizations in the pediatrician's office by the nurse. The first vaccination administered is the polio vaccine intramuscularly. The next one is influenza live administered in the nose. The last vaccination is the varicella live vaccine by subcutaneous route. What CPT codes are reported for the administration and vaccines? So this is a vaccination question from the medicine section. Okay. So you know how to code vaccine. When I had taken the vaccination guidelines, I had clearly mentioned, right, how to code subcutaneous, intramuscular, then oral, intranasal, all everything. Anyway, let's look into the options one by one. What is CPT code 90713? Option A, 90713 represents poliovirus vaccine inactivated. Yes, this is not live poliovirus intramuscularly, so inactivated for subcutaneous or intramuscular use. Yes, that is there. So first vaccine is polio vaccine 90713. Now second one. Next, what is the next code? 90658. What is code 90658? 658 represents influenza vaccine trivalent split virus. The second one is influenza administered in the nose. Okay, so that option A will not be the answer. In option B, there is no polio vaccine mentioned, 90713 mentioned. So that is not the answer. Let's move to option C, 90713 for polio. What is 90660? 90660 represents the influenza vaccine, influenza virus vaccine trivalent live for intranasal use. The option B code option A code 90658. Yeah, trivalent itself, but this is split virus mentioned. But in our question, it is trivalent live. So 90660 will be the code for influenza. Okay, live vaccine. That's why in the bracket they have mentioned live vaccine. Now, what is the next? The last vaccination done, varicella. That is also live by subcutaneous route. So in option C, third one, 90716. 90716 represents the varicella virus live for subcutaneous. Yes, these three we got the. So now we got the options for the vaccines. 3 vaccines options. Now we have to code the administration code also, right? So go to the administration part. Vaccine administrations will be starting from 904. So first one, 90471. 90471 represents immunization administration, percutaneous, subcutaneous, one vaccine. Yeah, first vaccine, intramuscular polio. So we will use that code. Now 90472 for each additional vaccine. Two more is there, right? Additional vaccine. And then, but one vaccine is given. One is intramuscularly, one is subcutaneous, and the influenza is given in the nose. So it means it is the intranasal. So we have to use the code for intranasal also. Which are the codes for intranasal? 90473 and 474. But we will not code 90473 along with 90471, as I had mentioned in the guidelines, and it's also mentioned just below the CPT code 90473. We should not use the main codes 90471 and 473 together. So we will use the additional intranasal code 90474. Same as mentioned in the option C. So our answer will be option C. Okay. The first three codes for the three vaccines: polio, influenza live, varicella live. And then the next three for the administration of these three vaccines. One is intramuscular, one is subcutaneous, and the other one is intranasal. So answer will be option C. Question 6. An established patient had a comprehensive exam in which she has been diagnosed with a dry eye syndrome in both eyes. So this is something from the ophthalmological session. Okay. The ophthalmologist measures the cornea and places the soft contact lens for treatment of the syndrome. What codes are reported by the ophthalmologist? So this is a consultation of an established patient, comprehensive examination. And then ophthalmologist had fitted, measures the cornea and places the soft contact lens. Fitted, like placed the contact lens. Okay. Let's move to the options one by one. First one, 92014. Just take CPT code 92014. It represents ophthalmological services, medical examination, ophthalmological services, comprehensive, established patient, one or more visits. Yeah, this is established patient comprehensive examination. So we will use that code and we append with modifier 25 because the ophthalmologist itself is conducting the procedure, going to conduct the procedure. Now what is CPT code 92071? 92071 represents fitting of contact lens for treatment of ocular surface disease. This is ocular surface disease, right? Because dry eye syndrome. So it occurs in the surface of the eyes. So 92071 represents fitting of contact lens. Yes, the contact lens has been placed. It's mentioned in the question. So this will be the answer. Okay. Now, if you take option B, 99214, but 99214, it comes under evaluation and management section. But if the question is something which is related to ophthalmology, we have a separate code starting from 920. See, 92012 and 92014 for ophthalmological services. So we will not code evaluation and management codes. We will use directly this code, ophthalmological services code. Okay, ophthalmology consultation codes. So that will not be the answer. Now, if you go to option C, same 92014 is there. What is 92325? With modifier 50, it's mentioned there. So, what is 92325 code? 92325 represents modification of contact lens. This is not modification. Here the ophthalmologist has directly placed the contact lens, fitted the contact lens. That's not the answer. What is option D? 92310. That is prescription of optical and physical characteristics. If you check the CPT code 92310, it's prescription of optical, and prescription means the doctor has given the prescription for placing of or fitting of contact lens. Here doctor has not given any prescription, but the doctor itself has done the procedure. So option D also is not the answer. So our correct answer is option A as mentioned. Okay. Now moving on to the 7th question. A cancer patient is coming in to have a chemotherapy infusion. So this is something which is related to the infusion section. The physician notes the patient is dehydrated and will first administer a hydration infusion. The infusion time was 1 hour and 30 minutes. Select the codes that should be reported for this encounter. So here the patient has came for chemotherapy infusion, but since the patient is dehydrated, chemotherapy procedure is not done. Instead, the hydration infusion procedure is being done. So we have to code only for the hydration, right? See, the question is simple. If you will understand the question carefully, it's very simple. So the infusion time, what is the infusion time? 1 hour and 30 minutes. So just go to the infusion codes one by one. 96360, what is 96360 represents? Intravenous infusion hydration, initial 31 minutes to 1 hour. We have 1 hour 30 minutes. So up to 1 hour we will code 96360. And what is additional code 96361? That is each additional hour. It is not 30 minutes, it is each additional hour. So it means our time, if our time reaches 2 hours, then only we will use the code add-on code 96361. Since our infusion time is only 1 hour and 30 minutes, we will use only the initial code 96360, which is our answer. Okay, so our answer will be option A, 96360. This is how you need to code for the hydration codes. You have to code each hour separately. So answer is option A. Now 8th question. A 6-year-old patient comes in for a preventive medicine service. Along with the exam, the physician does visual acuity screening using the Rosenbaum test and a hearing screening test. The patient only responds to tones of different pitches and intensities. What CPT codes are reported for the visual acuity and hearing screening? So here we have to code for two codes. One is visual acuity and the other one is hearing screening hearing test. So let's move to the options one by one. Option A, 99170, 92550. What is it? Let's look into 92550 first. So the first option will be for the visual and the second one will be for the screening hearing. What is 92550? Open 92550. It represents tympanometry and reflex threshold measurements. This is not tympanometry. So options 92550, wherever code is coming, that is not the answer. So option A and D we can skip. Now option B and C. Let's check option B and C. What is 92551? 92551 represents screening test. Pure tone, air only. Yeah, this is screening. Pure tone, air only. Pure tone means that is, what is that? Hearing test. Pure tone, air only means hearing test, because it's mentioned in the question. The patient only responds to tones of different pitches. Okay. So 92551 will be the answer for the second code. What about the first code? 99172, option B, 99172. 99, just take 99172 and option C, 99173. So 99172 represents visual function screening, automated or semi-automated bilateral quantitative. What is 99173? It represents screening test of visual acuity, quantitative bilateral. Ours is screening only, right? Both are screening test, visual acuity and hearing screening. So it's visual acuity screening test using the Rosenbaum test. It's mentioned there. So our answer will be option C, because this is screening visual test. Okay. So screening visual test and pure tone hearing test. So answer will be option C. Now 9th question. Today in the office, a 53-year-old receives 2 allergy injections IM in her left upper arm for rugweed and cat dander. The doctor administers the allergen extract brought in by the patient. What is the CPT code for this service? So here the patient had come for allergic injections, 2 IM injections. Anyway, let's look into the options one by one. So this is from Allergen immunotherapy. Okay. So first option 95144. What is 95144? Professional services for the supervision of preparation and provision of antigens for allergen immunotherapy. No, this is not that. This is injection only, allergen injection. So that is not the answer. Option B, 95117. What is 95117? Professional services for allergen immunotherapy. allergen immunotherapy, not including provision of allergenic extracts, 2 or more injections. 2 injections here it's given, right? So 2 or more injections. So this can be the answer. Anyway, let's check the other options as well. 95165. What is 95165? Professional services for supervision of interpretation, single or multiple antigens. Here it's not mentioned about injection. What is 95125? 95125 represents professional services for allergen immunotherapy in the office or institution of the prescribing physician or other qualified healthcare professional, including provision of allergenic extract, 2 or more injections. So here, what are the common, the options that which represents the answer? It can be either option B or option D. Option B 95117 or option D 95125. But what is 95125? It represents including provision of allergenic extract. But in our question, the allergenic extract is not included. Why? Because in the second sentence it's mentioned there, the doctor administers the allergen extract brought in by the patient. The allergen extract is being brought by the patient, means the injection is being brought by the patient. So that is not included. So in our option B, 95117, that is professional services for allergen immunotherapy, not including provision of allergenic extracts. This allergenic extract is not included. Yeah, it is not included, right? It's not given from the doctor's office. It's brought from the patient. So answer will be option B, 95117. Okay. Now let's look into one more question from the pathology. Last question, 10th one. A patient with AIDS presents for follow-up care. The total T cell count is ordered to evaluate progression of the disease. Choose the codes for this study. So here we have to code for T cell count. Let's look into the options one by one. First one, 86703. What is code 86703? Just take 86703 from the CPT code book. 86703 represents HIV and HIV1 and HIV2 single result. Now we have to code for T cell count. That's not the answer. What is option B? 86360. 86360 represents T cells, absolute CD4 and CD8 count. Ours is total T cell count. That's not the answer. What is option C? 86361. That's also again absolute CD4. Not the answer. 86359. 86359 represents T cells total count. Yes, we need that, right? T cells total count. So our answer will not be option C, because option C is having 2 codes mentioned. Total T cell count and then 86361 is absolute CD4 count. We don't want that, right? We want only the total T cell count, which is option D, 86359. Total T cells count. So our answer will be option D. So friends, these are few questions, CPC practice questions from the previous years from 80,000 and 90,000 series. If you have any clarifications or inquiries, you can always mention it in the comments, and I'll be replying back to you soon as possible. Okay. This will be the end of the CPT code book section, and we'll be doing more practice questions later once we finish with the ICD and HCPCS. So next we will be moving on to we will be starting with the ICD code book. Okay. From the next episode, we will be starting ICD. So stay tuned for more videos, and thank you so much for supporting me. If you are new to the channel, please like, share and subscribe to my channel. Okay. Thank you. Bye.